Hi guys, I'm Dr. Iraniha. I'm a board certified general surgeon, and I have been in practice over the last 2 decades in Southern California, Orange County, Newport Beach area. My main interest is minimally invasive surgery, including robotic and laparoscopic operation, and my main focus of the practice is major and complex abdominal wall hernia repair and body contouring. The videos that you're going to see is my experience through bilateral knee replacement. Unfortunately, I have developed bilateral knee arthritis and is associated with the pain and discomfort, and I need to have this type of operation in order to recover and go back to my normal life. And I thought it would be very interesting for people to hear and see my actual experience through this operation for multiple reasons. Number one, it's because of my unique age group that I'm going through this operation. Number two is that I'm going through bilateral knee replacement, and I watched so many videos on the social media, and I didn't see that many people with the bilateral knee replacements and sharing the experience, and I thought might be helpful. And the other last reason is that I'm a surgeon myself, and I deal with patients post-operative pain and discomforts and recovery, and I thought looking at this operation from a surgeon eyes and also a patient perspective might be very helpful, and that's why I'm going to share my experience with you. But again, I'd like to emphasize that I'm not an orthopedic surgeon, and I'm not a certified and licensed physical therapist. So whatever I say in these videos and what you see from my post-op recovery, including my pain medications regimen and also the exercises that I'm going to show you, are not a medical advice. If you have any question or concerns, you definitely need to talk to your orthopedic surgeon or discuss the matter with your certified and licensed physical therapist. Hi guys, today is my surgery day. I'm supposed to go at 11:30 to the hospital to register for my operation, and my actual time of the surgery is 2:30. So I thought before I go to the hospital, I share with you how I prepare myself over last week and also today prior to the surgery. So since 5 days ago, I started taking Iraniha, which is a natural over-the-counter product to decrease the bruising and swelling after the surgery, and also started taking Cereblex, which is anti-inflammatory medication to decrease the pain and swelling after the surgery over the last 3 days. The other thing that I did was to wash my body with chlorhexidine over the last 5 days every day, and that decreased the risk of infection after the surgery, and also using the alcohol swab in my nose to decrease the possibility of a post-operative infection. So those are all measures that I was told to do based on my surgeon's recommendation, and I also prepare myself proceed with the surgery with the equipments that I needed post-operatively. So this is the operation that the success of the surgery is not only important based on who your surgeon is, how the surgery goes, but also post-op recovery and rehabilitation is significantly important, and the role of the patient is very critical and essential. That's why you have to participate in this recovery, otherwise the result would not be pleasant or successful. So I prepared a lot of things for my post-op recovery, including the equipments that I need for exercise, and also my equipment that I need to ensure my safety, because as you can imagine, going through double knee replacement, you will have significant pain, difficulty walking, and initially making sure that you do not fall and follow the safety measures are very critical. So I bought a bunch of little equipments that is necessary for after the surgery, including walker to walk after the surgery, safety rails around your restroom, so when you sit down and up, you don't fall. You have to make sure that there's nothing on the floor that's slippery and increase the risk of fall after the surgery. So I did all of those, and also I bought a bunch of equipment that is necessary for me to do my post-op exercise, including this table. This is a massage table, but it's good for the physical therapy. This is very light, and you have to make sure that before you buy anything, it's medically rated and also tolerate your weight. And it's very secure. So when you go on the top of this with two knee replacements, you don't fall. So that's one thing that I bought. It helps me post-operatively to do my exercise and that is necessary for my rehabilitation. I also bought a bunch of little strap that is helpful for my movement from in and out of the bed and lifting my leg, and I'm going to show you in my next videos. I prepared also a room in my house, which is my old daughter's room when she was younger. So the bed is a little lower, so it helps me to sit and stand up a little easier on the bed. And I bought a wedge that is necessary for me to raise my leg after the operation. And I also bought ice machine, which is helpful to cool down my knees to decrease the swelling and pain after the surgery, and also ice pack. Those are the equipments that I needed, and the way I study and prepare myself prior to the surgeries, I went to the internet, looked at a lot of videos from different orthopedic surgeons and physical therapists that they were talking about the post-operative rehabilitation, and I basically catch and understood what is necessary for my recovery, and then based on that you can choose what to get and prepare yourself for the surgery. Because when I come in home, I need to really be aggressive about my rehab. Yesterday I went to my office. I had a very busy office, a lot of new and patients and some follow-ups, and I want to make sure that my practice is secure and settled down, and all the patients are taken care of before I go on a long recovery. So those are the stuff that I needed to take care of to decrease my nervousness prior to the operation. But regardless, when I was driving home, I was a little nervous, and I think as it was getting closer to the date of the surgery, my nervousness was increasing, and I think it's very normal. And as a surgeon that operates every day and deal with a lot of patients pre and post operatively, I always try to make the patients calm. But I can now understand that regardless of what I say, the fear and anxiety is part of the normal pre-op feeling and sensation. So how I decreased that is I woke up this morning at 6 o'clock because I wanted to have my daily coffee, and as you know, you can't eat 8 hours prior to the surgery, so that's why I woke up early in the morning. I had my coffee and I did my routine 1 hour exercise, which includes half an hour of yoga and half an hour of body weight exercises. Obviously it's modified since I have knee issues. I can't do what I used to do, so I modified my exercises, but it was very helpful to prepare myself mentally and physically prior to the surgery. And I took a shower, and I had some water and Gatorade. Per recommendation, I had to drink up to 3 hours prior to the surgery to hydrate myself, and I've done that. So I'm almost ready to go, and I will probably take you through day of the surgery and even post-op right after the operation. My hope is that I feel good enough after the surgery that I will be discharged right away, but if not, then I probably stay one night in the hospital. But hopefully I feel good enough that I can come back home. That's my goal. Thank you.
Hi, almost 2 hours before my surgery. I am already prepped for surgery. I received my pre-op medication and got my IV. So I'm just patiently waiting for the surgeon and anesthesia to come in and have a discussion. Bye. See you after surgery.